I'm Holly Cohen, host of the Medigap Show, owner of a Medicare insurance agency, and past advertising executive. So want to clear up some things that have been just running rampant over the last 2 years. Today's video, we're going to take a closer look at Medicare Advantage plan commercial. So even with recent crackdowns on misleading Medicare advertising, some commercials do still continue to air with confusing and very misleading information. As a past advertising executive and a current Medicare agency owner, it's my job to point out the misleading parts and clear up any confusion. So let's get started and let's uncover the truth behind these misleading and very confusing commercials. Okay, so let's get started watching this video. Here we go.
Al, did you make that call?
Honey, we already have Medicare. Why do I need to call?
Alan, the Feldman said we may be able to get additional benefits with a Medicare Advantage plan right here in our zip code with $0 monthly premiums.
Honey, what do you mean additional benefits? We turned 65, we got Medicare. That's all there is to it, right?
I'm talking.
Okay, so just right there, they were talking about their neighbors, the Feldmans, who can get a Medicare Advantage plan for a $0 premium. Number one, that's not a good way to go about this. It's never good to compare yourself to a neighbor when you're beginning onto Medicare. Your situation, your health, your finances, their finances are going to be totally different. So there's no one size fits all when it comes to a Medicare keeping original Medicare, which pays 80%, and enrolling in a Medicare supplement or Medigap plan, or going on the Medicare Advantage plan program. So there's just not one size fits all. So for this lady to say that their neighbors, the Feldmans, are on this plan, it's not real wise to try to talk her husband into this. But here we go. Let's continue.
Commonly called Medicare Advantage. We have traditional Medicare, which is only Medicare Parts A and B, but not Part C.
Wait. So not everyone on Medicare is a Part C
Okay,
plan?
so she just told him, he said, we enrolled in Medicare, we're done. And she said, we only have Part A and Part B. So it sounds like that's all they did, but they may also have enrolled in a Medigap plan, unbeknownst to them. And they're talking to the Feldmans down the street and hearing that the Feldmans are on a Part C. What is a Part C? A Part C is also referred to as a Medicare Advantage plan. All right. So a Medicare Advantage plan is a replacement for your Part A and Part B. It's literally you giving up your Medicare rights that you've paid into your whole life when you've been working, paying into the system, and you still have to pay it when you turn 65. It's giving up those rights over to a private for-profit insurance company to manage your health care from beginning of Medicare forward. So the commercial is already misleading because she's saying that they don't have Part C. And, again, she doesn't even know what Part C really is. She doesn't know that it's a replacement. Okay, here we go.
No, that's why we need to call, because there may be plans available with additional benefits that aren't covered under Medicare Parts A and B. We don't have a Medicare Part C plan, which covers everything in Part A.
Okay,
and
so
Part
you
B.
can't have a Part C, which is Advantage, and traditional Medicare or original Medicare Part A and B at the same time. Again, Medicare Advantage, also known as Part C, is a replacement for your traditional original Medicare Part A and Part B. What does that mean? It means that, again, you give up your rights, and she's just making it sound like they need A, B, and C, and that is not the case for everybody. It's not one size fits all. Let's go.
Extra benefits in Medicare Part C.
What kind of extra benefits?
There are great plans that may be
Okay,
available with
so
extra
a
benefits.
Medicare Advantage plan, yes, it is required. Every Medicare Advantage plan, they are required to include everything. They have to cover all of the items that Medicare must cover, right? But because it's not direct Medicare, it's a third party, an insurance company replacing your original Medicare. It's up to if you give up your original Medicare, traditional Medicare, over to an Advantage plan, that Advantage plan insurance company gets to manage your care. They decide what doctors you're allowed to go see that are in their PPO or HMO networks. They decide on prior authorizations. So she's not explaining and not understanding that you are giving up your Part A and Part B to go on to Part C. So a Part C cancels out traditional original Medicare Part A and Part B. Cancels it out. In fact, if you go into a doctor's office and you're on Medicare Advantage and you hand them over your Medicare Advantage plan card, the doctor's office is going to bill directly to that insurance company. And the federal Medicare program doesn't even know you went to the doctor because they've actually turned over your healthcare to that private insurance company. So by calling this number on your screen, you are giving up Medicare rights. If that's what you want to do, that's fine. Some people it works great. And it, again, depends on your specific situation, your finances, your health. Lots of factors go into that choice, which way to go, whether you choose Medicare Supplement, also known as Medigap, or Medicare Advantage. We're going to keep watching this misleading commercial. Here we go.
Like dental, vision, and hearing.
Did you say dental?
Yes, dental. Medicare Part C plans could include dental benefits that help cover routine dental exams and teeth cleanings, plus dental x-rays, fillings, gum disease treatment, and dentures.
Okay, so what she just described is a dental plan that anybody can purchase for about $28 to $30. The one that it does cover dentures, it might be a little bit more costly, closer to $60 a month, but it's well worth it. The Medicare Advantage plan programs, Part C, they do, many of them, most of them, almost all, include a free zero premium dental plan. What does that give you? 2 free cleanings, a set of x-rays. Some plans really, they do cover dentures. It depends on the plan. But the problem is by taking that choice, going on to Medicare Advantage and putting everything in the bundle, you're replacing your Part A and Part B with a Part C Medicare Advantage plan that will include a dental policy. By doing that and not doing it the other way, which is a la carte, where you have your traditional Medicare A and B, which lets you, your gold ticket takes you, and your red, white, and blue card will take you to any doctor, any hospital in the whole United States. And original Medicare out of our Medicare fund will pay 80% of any bill that's medically necessary for you that your doctor says you have to have, and no questions asked. And then by federal law, if you have Medigap, known as a Plan F, a Plan G, or a Plan N, that letter will pay the 20%. Original or traditional Medicare does not include dental unless it's an emergency dental procedure in a hospital setting or in a, more of a very intense medical dental procedure. It's not going to be covered under traditional original Medicare. So these commercials are so misleading because they're making a person think that if they take on a Part C, which remember replaces their A and B, that they're going to automatically get this nice dental package. But they can truly buy a dental policy. They can keep their traditional Medicare, enroll in Medigap, which pays 100% of your bills, lets you go anywhere you want in the whole country. It's the best healthcare we've ever had. It started in 1966. It's still working. It's incredible. I wish I could be on it. I will be in a few years from now. It just doesn't give you dental coverage for traditional or routine dental care. So I always suggest to our clients buy an additional $28 dental policy. Dental policies don't give you that much anyway, unfortunately. Dentists, they retire young is always my joke. Okay. I hope there's no dentists out there that are mad at me. But there's just dentists don't like insurance. So let's go back to the question.
I'm calling.
If you're losing coverage, moving, or new to Medicare, call to speak with a licensed insurance agent.
All right, so let's just back it up. What they just showed was what are called special enrollment periods. When we're not in our open enrollment for these Medicare Advantage plans, which is October 15th through December 7th, that's when you can enroll in a Medicare Advantage plan. The rest of the year, insurance agents that write Medicare Advantage plans, big call centers that function on writing only Medicare Advantage plans, insurance companies that make a lot of money from the government and hedge funds on Wall Street, to put out these massive Advantage plans, they can't write these policies and when it's outside the open enrollment period, which is October 15th through December 7th, unless the person qualifies for an SEP, a special enrollment period. So that's what these three are: losing coverage, moving, or new to Medicare. It puts you, well, new to Medicare, it puts you into your initial enrollment period. But there are a few more SEPs based on disasters in your area and things like that that FEMA might be offering. But other than that, these commercials, again, misleading. And there have been massive call centers over the last year and a half that have based their entire business model, getting a prospect or a person already on Medicare, either on Medicare Advantage already or just on traditional Medicare, to come off of it because of those SEPs, those special enrollment periods. The government's cracking down this year on many of these items. So, all right. Just wanted to cover
If
that.
you don't have a Medicare Part C plan, call now because there may be plans with.
Okay, also very important to note, every Medicare Advantage plan is specific to the person or the Medicare Advantage plan's county. So there are hundreds and hundreds of Medicare Advantage plans across the country, and they're all unique based on where the person lives. It's very complex, and they are $0 premiums, but they have a massive out-of-pocket cost of $8,300 on the big PPO plans. You have to deal with prior authorization. So if your doctor says that you have to have something that's medically necessary, if you're on a Medicare Advantage plan, you're not going to necessarily be able to get that treatment right away. And if at all, if the insurance company denies the claim or denies the prior authorization or puts that patient through what's called step therapy, which means they have to do, A, B, and C before they can go on to get their treatment. Very frustrating things that can delay healthcare as we age. And this is the population of the United States that needs the best healthcare possible. And that best healthcare started in 1966. It's our traditional or original Medicare program. These commercials are incredibly misleading. I'm happy to see that many have been cracked down. They used to be worse than this one. I wanted to pull one that was from right now and see, compare it to really what the real rules are. They did crack down, but it's still going to be misleading. It's still going to mislead seniors off of traditional Medicare, which many of them need to be on. All right, that's all for today. If you like this video, remember to hit that like button, please. And also, please, your subscription is so important. Subscribe to my channel. I just try to put out the most beneficial information possible for people who are just starting Medicare, who are on Medicare. I've been doing this a long time, and I really love it. It's my passion. I like to educate people, make sure they understand completely what Medicare is and the two different ways you can have Medicare, because there are too many people I speak to after the fact, once they've already been on Medicare for 6 months or longer, that can't make changes to their health care, and they're stuck on a Medicare program, a certain one, for the rest of their lifetime. So anyway, all right, that's all for today. Remember to hit the subscribe button and like the video. Take care.